All right, that's amazing. And last up before lunch, one last shout out. So, I think that radiology, I got to tell you, before the last 2 years, I hadn't really thought about radiology as being on the cutting edge of patient-centered care, but I've really changed my perspective. I've really learned so much about the eagerness of our radiology colleagues to meet people where they are and be flexible and creative about it. Additionally, I've had the privilege of working with Ben Macri, who's a nurse practitioner at Freedom Trail at North Suffolk Mental Health Association, and a collaborator of ours in the collaborative. And he has really taken a really important role in advocating for his patients and for the greater population served by North Suffolk. What we're going to talk about is what happens when a community mental health association gets together with MGH radiology and innovation occurs.
I don't need to, I can, what? Oh. I'm just relieved that there's not a picture of me up right now, except for the one that's been up earlier today where I'm in sunglasses. But so I'm a member of the collaborative and I'm a part of the advocacy work group. And just so you guys know, I'm going to throw in the pitch. There are sign-up sheets outside. We encourage, there's a bunch of different work groups, and really, if you are interested, everyone in this room already knows how much work this is, and Kelly's doing most of it. And so we're just trying to find people who will do a little, who will help us out. So please sign up if you're interested. So one of the things that's so striking about the mortality gap is, that there are so many pieces of it. And I think one of the things that the collaborative has really started to focus on is not just caring for people who have active cancers, but starting to really understand that to reduce that gap, we're going to have to think about prevention and that means screening. And so one day a week, generally, I'm out in the community meeting with folks who adamantly refuse to come into the clinic. And I'm very lucky that the organization that I work for, North Suffolk, allows me to actually go out to these places, because if not, these people would not be getting care. Some of them might still be getting medicine, but I don't know who would be prescribing it. And these are people who absolutely need support. Just because they are not willing to come into a clinic doesn't mean that they don't need help. And so when I'm out there, I often ask the staff if there are other people that they're worried about. And that's how I met a woman that I like to call the drummer. She's a woman who's in her mid-40s. She has schizophrenia. She's been in treatment for a long time. She actually gets her primary care, her psychiatric care through Boston Healthcare for the Homeless. But she's not great about going to her appointments. And the house was worried because at the last visit, they had found a mass in her breast, and they had said, we need to get a mammogram. And she had just not gone. And they had said, you should go, but there wasn't a way really to make her go, because what she generally does every day, and it's fairly concrete, she gets up in the morning and she meets up with her husband who's homeless, and they panhandle for money by playing drums on the streets of Boston. So you might have seen her, because we know that these people are in all of our communities, and we see them, and we walk by Fenway Park or walk by in the subway. And we don't think about how that's kind of a barrier to healthcare if you're going to spend most of your day panhandling. It doesn't leave a lot of time for appointments. And so contacted the psychiatrist, talked with her. She just said, I think she's amenable. It's just a question of how do you actually get her there? And I arranged an in-person meeting with her the next time I was at the house, and I explained sort of that because I have this knowledge with the collaborative and working with Kelly, that actually, you know what? We could do all of this just one day. Just all you have to do is get in the car with your in this case, it was a CBFS worker, and come down. We'll get you some breakfast and some coffee. We'll go up. And she said, you know what? I think I can do that. And we contacted everyone. We said, because I've done this before with other people, and it takes a few tries, and sometimes it doesn't work. But in this case, first try, she got in the car, came over, had breakfast, came up, got the exam. And the best part of this story, for me at least, is that it wasn't anything. That this was not someone who actually this was not a cancer. This was not someone. And there's something about that is so hopeful, that some of this is just finding out some people are okay, but we checked. We double-checked.
And the fact that MGH radiology has an ability to be flexible with not needing an appointment for vulnerable populations. that we were able to have a conversation about that and we have the director of MGH breast imaging here. I work with Dr. Efren Flores and Gary Wang, and I was saying it's been really wonderful to think together about how we can think about radiology encounters as a wonderful opportunity to meet people where they are, but also to try to be flexible. So I wanted to turn it over to Brian and Dr. Dontchos to talk from his perspective.
This is so great. Thanks so much for inviting me, Kelly. Really appreciate it. So my name is Brian Dontchos. I'm the service chief of breast imaging at Mass General Hospital. And so basically what that means is I oversee the delivery of quality care. Is the microphone?
Maybe use this one.
Okay, maybe I'll just stand. He's going to put it.
I broke it.
That sounds better. Okay. All right. So I oversee the delivery and quality care of our breast imaging center at MGH. We operate at 6 locations in eastern Massachusetts. We actively staff radiologists at 4 of them, but our main location is at MGH just across the Charles River. And so just to give you an overview of our program, we see about 80,000 patients a year. We do around 50,000 screening exams every year. And although we are a large research institution with education, patient-centered care is always at the center of every decision and everything that we do every day. And so I want to take a few minutes just to talk about some of the initiatives that we have and give examples of that. One of the first things that we have done in the last 2 years is a program called the Pink Card Program. And so we have these small business cards. I have a stack of them with me. I'm happy to hand some out if anyone has questions after this. We basically give them to our referring providers who can give them out to their patients. And if the patient shows up with this card at our imaging center, we'll bring them back for a screening mammogram if they're due for one. And so we found that's really beneficial to get patients in the door. As you can imagine, so taking a big step back, what are we doing with breast imaging and why do we screen women for breast cancer? We know that around 1 in 8 women will have breast cancer in their lifetime. Every year in the United States, around 40,000 women die of breast cancer. And so the goal of screening mammography is to detect a breast cancer before it's clinically evident, so before you can feel it or before there's abnormal skin changes or there's nipple discharge. And so the goal of identifying a cancer when it's small may mean that there's less invasive surgery, may mean that there's a reduced need for chemotherapy and an improved survival. And so we basically recommend, the American College of Radiology and Society of Breast Imaging recommends women beginning at the age of 40 have an annual mammogram. Anyway, so with the Pink Card program, our goal is to bring women in for these really important exams. And it's kind of like going to the dentist, right? You only go when you have a problem, so it's difficult to get people to come in for an exam when they don't have any issues. So we've seen time and time again in the literature that anytime you remove barriers or provide incentives to get women in for screening mammograms, it improves uptake. And so the Pink Card program is one of these programs. Another thing I want to talk about is our same-day biopsy program that we have at MGH. So if you can imagine, if a patient comes in with a focal sign or symptom, they feel a lump or they have pain, or if they're being brought back for an abnormal screening exam, we will make every effort, if they require a biopsy, to do the biopsy at the time of the diagnostic imaging. So in the past, we would oftentimes have the patient schedule days out, even weeks out. But we find that being more flexible and being able to add these cases on the same day when they're here, we're capturing more patients and getting their diagnoses faster. And so you can see that would, when we implemented this program, we knew that it would reduce the mean time for all of our patients from the time of recommendation to the time of diagnosis. But we actually studied different patient subgroups to see what impact this had on disparities. And so we actually found that before the program, our non-white patients were waiting an average of about 3 days longer than our white patients for biopsies. Our older patients were waiting about 2 days longer. Our governmentally insured patients were waiting around 2.5 days longer than privately insured patients. And all those disparities went away after the same-day biopsy program. So this is something we have submitted for publication, so we're very proud of that. So these are a couple of the initiatives that we have going on at our downtown location. And so that's pretty much all I wanted to say. So thanks a lot. I'm happy to answer anybody's questions after the talk.
All right. Thank you so much. Everybody has kindly brought lunch in, which will be great. We're going to take a little break and have some lunch. During the break, talk to each other, go over and see the art initiative. It's absolutely beautiful, created by members of the collaborative, and we look forward to continuing the conversation. Thank you.